is not sound. It's air vibration. How do we make air to vibrate? We're pushing air out of our lungs through the vocal cords, and those vocal cords are going to start to vibrate. And what comes out of those vocal cords that are in the larynx is exactly that, air vibration. Those vibrations enter the mouth, the nose, the sinuses, and with the opening and closing of our mouth and moving of our tongue, depending on the language that we choose to speak, we're generating, bless you, we're generating some air vibrations that are coming to our ears, somebody else's ears, and then that's when the magic happens. The air vibrations enters the ear through the auricle or pinna. So this part of the ear, it's called pinna. Everything that's not only mine, but yours also. So pinna. Don't think of pina colada, okay? Has nothing to do with that. So pinna. The model of each and every one's pinna is different. It's unique. It basically makes us identifiable as individuals better than fingerprints. This is unique. This is part of the biometrics. That's why they tell you pull your hair back behind your ears when you take a passport picture. From the pinna, we call it sound, right, enters the external auditory meatus. This is the external auditory meatus. External auditory meatus. And then it hits the tympanic membrane. Tympanic membrane has a couple of bones connected to it. 3 to be more precise. The first bone that is connected directly to the tympanic membrane is the malleus. Malleus. Malleus is beating, if you want, is hitting the anvil, right? And the anvil is pulling on the stirrup or stapes. Stapes. So this is the stapes, this little thing here. If you want to look at them in real life, those 3 little ossicles are these, right? Malleus, anvil, and stapes. So after the sound has pulled and pushed on these guys, the very foot of the stapes, which is excuse me, oval, sits on this opening in the cochlea that is called the oval window. So you're gonna say, okay, how are you gonna ask this question? Well, I can put a sticker here and say, name this structure. And you're gonna say stapes. And the second question connected to it might be, what structure does it sit on? And your answer is gonna be oval window. From the oval window starts 2 things. One is the vestibule. This entire space here is the vestibule, and this is the cochlea. It looks like what you call it, the snails, the house or the shell, right? So cochlea. From the cochlea, which is basically this guy is here. So if you take this apart, you can take it apart. And what you see is this. So this here is this. Make sense? So it's a thing that goes, is this structure that goes through the bone, right? And the bone inside makes this cochlea. If you ought to pull this from this end, you would end up with a snake-looking like structure. Thicker at the beginning and thinner as it goes towards the end. But it's like one. So here we have all the nerve fibers that are coming from inside the cochlea, and they make what we call the vestibulocochlear nerve. So this is the vestibulocochlear nerve. This branch, because it's coming from the auditory, right, part of it, is the cochlear nerve. This part that comes from the vestibular, because this is the vestibular part of it, is called the vestibular part. So you have the vestibulocochlear nerve right here. Before we get to the nitty-gritty of this, let's talk about these three semicircular canals. These three semicircular canals, they sit in the temporal bone of our both temporal bones, and they're responsible to let us know whenever we move our head. They're responsible to let us know what the position of our head is at all times. We move to the right, these guys are telling us, oh, this guy moves his head to the right. We move the head down, it tells us it moves the head down. It moves to the left, it moves to the left. You rotate it, it rotated. It's dizzy. Okay. This information comes from the semicircular canal to the brain via the vestibular branch of the vestibulocochlear nerve. Sure. I don't know. And I'm going to tell you why. Vertigo is a very complex. They call it neurological thing because it has a neurological aspect to it, not only an auditory but a balance thing. I think vertigo is when you feel that the room is spinning around you. Not. Sorry.
No, I work with a single doctor, but I can't answer that question.
Okay.
That's why I was asking because it's like I can see the picture of it. So
Okay. Okay. So, to my knowledge is very reduced. So you gotta ask, people who are actually working. You working in a neurology office?
no, but PT,
What? Oh, physical therapy. Physical therapy. Okay. So you do physical therapy for vertigo, for vestibular things. That's very good. So these are the semicircular canals, right? So if a sticker is here, you're gonna say what? Semicircular canal. If the sticker is here, you're gonna say vestibule. If the sticker is here, you're gonna say cochlea. If the sticker is here, you're gonna say cochlear nerve. Okay? Now getting inside the cochlea, we have this guy, right? And this guy is what's inside here, right? So here is this. You see it? It's exactly that. Now, what do we have? We have sound that travels via the tympanic, scala tympani, and then it goes to the apex of the cochlea, comes back on scala vestibuli, but for some reason I think it's the other way around.
Yeah.
This is scala tympani and this is scala vestibuli, obviously, because this is vestibular membrane. So it travels via scala vestibuli, goes to the helicotrema, and then goes back to the scala tympani. When it goes back, the sound, these vibrations, when they reach the perfect narrowing of the tympanic, of the scala tympani, they hit the basilar membrane. This is the basilar membrane. Basilar membrane, the membrane that's on the base of the what? Of the organ of Corti. This whole structure is the organ of Corti. The organ of Corti has these cells that are called the hair cells, and these hairs are basically almost touching the tectorial membrane. This is the tectorial membrane. When the sound hits the basilar membrane, it sends the organ of Corti hair cells with the hairs, and it touches the tectorial membrane. It excites
mechanically excites the hair of the cells, transforms that mechanical excitation into a nerve impulse that travels via the excuse me, cochlear branch of the vestibulocochlear nerve to our brain, and we make sense of what this was, which is a sound. But that sound is particularly characteristic to a wavelength, to a particular narrow waveband from the wavelength of that sound. So we mentioned scala tympani, scala vestibuli, scala media. This space here is scala media. What separates scala media from scala vestibuli is the vestibular membrane. This is the vestibular membrane. We have liquid here. We have two flavors of liquids. In scala tympani and scala vestibuli, we have a flavor of liquid that's called perilymph. In scala media, endolymph. Difference in concentrations of ions and proteins and things like that. This is all I want you guys to know about before we go to this duct here that is between the middle ear, where there is still air, and the internal ear, where there is just liquid. So this duct here is called Eustachian tube. Eustachian tube, or the tube of Eustache, or Eustachio, depending on the language that you want to use. Eustache is in French, Eustachio is in Italian, sorry. Eustachian is in English. What is it good for? Because this Eustachian tube opens in the pharynx. So what's the connection between the pharynx and the ear? You're going to say, there's no connection. There is. It's the air that travels from the pharynx, so from the mouth and nose, to the tympanic membrane and balances the pressure that the sound is bringing from the outside. So when you're at the, I don't know if you guys like, concerts, music concerts or whatever, loud sounds, it's a good idea to keep your mouth like semi-open, like a little bit, and breathe in, because when you do that, you balance basically the boom, 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 boom that's coming from the outside with the pressure that's coming from your nose and mouth, so it doesn't break your, doesn't rupture your tympanic membrane. Make sense? That's it.
Professor, what about nothing here?
Blood vessels.
Oh, okay, so that's
I think it's
okay.
I think it's the internal carotid, but I wouldn't go there. I'm not gonna put stickers on that.